Nview Health is a company that was incorporated in early 2016 to begin to provide behavioral health assessments predominantly into two areas: research, both on a worldwide basis as well as independent research organizations, and also on the commercial space to be able to provide physicians, predominantly in the United States, with the opportunity to get good behavioral health assessments that are accurate and timely and can be used easily in an office. We have a series of scales. The scales include the MINI, which is the Mini International Neuropsychiatric Interview. We have the SSTS, which is the Sheehan Suicide Tracking Scale, the SDS, the Sheehan Disability Scales. We have homicidality scales, and we have a series of tracking devices or outcome measures.
It is important that healthcare providers beyond the psychiatric community or beyond the psychology, mental health community, pay close attention to mental health problems. Why? Because in any family physician's waiting room on any busy afternoon, at least 15 to 30% of all the patients in the waiting room have a mental health problem. And most primary care physicians know that. The problem is they don't know necessarily how to evaluate that quickly and easily and what to do next.
We have a number of tools that assist primary care providers right now. We have depression screens and anxiety screens and so forth. But we need more comprehensive diagnostic and assessment tools that don't limit the thinking of the provider in terms of depression, anxiety, and so on, and don't box patients into specific diagnostic categories.
Risk-bearing entities, schools, correctional facilities, and population health software companies are all reacting to a very loud call for more attention in the behavioral health space. The problem is it's a very vague call. The one thing that is very clear is that behavioral health can no longer be considered only when contemplating an illness. Behavioral health needs to be a fully integrated solution for both physical and behavioral health. That's what Nview Health is trying to provide.
The Nview Expert System is really easy for people to use. It has a natural interface for people to use. It has a natural sort of flow to the questions and answers. The learning curve for staffs to be able to deliver it is quite short. So we find that the tools themselves are easily used by staff and easily accepted by patients.
Nview's tools are built on the philosophy that it's fully agnostic and will be available to all systems that are out there. That may require different implementations by client, but we have not built any specific one-way tool sets so as to make sure that we're able to integrate with any databases and any EMRs.
The tool is available to providers in their offices by two methodologies. They can hand them a tablet, and secondly, they can email out the test to the individual patient before they come, or they can have a staff member ask the questions of the patient.
Earlier identification of behavioral health conditions is going to help eliminate overspend of misdiagnosis or no diagnosis of conditions, misprescriptions of pharmaceuticals, simple things like missed appointments due to depression conditions. All of these add up to a tremendous misspend for the U.S.
The size and scope of the worldwide research for Nview is quite large. We provide these tools to most of the major pharmaceutical companies worldwide to be able to use in phase 3 and 4 trials. These tools are accepted by the FDA in this country as acceptable for research. So we provide these research versions of our tools literally around the world on a daily basis.
Nview's next steps are exciting. We're going to be adding to the screener and assessment the ability to actually take care of patients. We want to support our doctors by being able to provide them a referral network that has a nationwide network of social workers, psychiatrists, and psychologists, complete with a telehealth platform as well as institutions.
Nview Health is dedicated to improving the lives of people with behavioral health disorders. We are moving forward with all kinds of new tools and new platforms to provide that service, both here, abroad, in the markets of day-to-day patient care as well as in the research marketplace.